My pain story began a lot of years ago, 30, 40 years ago, 30 years at least. Mostly after I came back from Saudi Arabia. Headaches, joint pains, severe joint pains. Headaches where I wake up with headaches, like different types of headaches all the time. Always have sinus problems, respiratory problems, and stuff like that. The different things that I do through Whole Health, you know, like I do yoga, I do acupuncture, the tapping, you know, different ways of helping to calm my body, to relax my body and stuff like that, you know. So it helps, you know. Does it go away? You know, the chronic pain is chronic pain, it's there. But I am able to live a better life because I know that when I'm hurting, I don't have to dwell on the hurt. I learned about FRG through the physical therapy with one of the sessions through you. I came and I think it was something that I needed to incorporate in my life. I needed to be able to obtain some tools to better sustain my journey with my pain.
My name is Jennifer Beatty Miller, and I'm an outpatient physical therapist. I've been an outpatient physical therapist here at the Milwaukee VA for about 21 years. The Functional Rehabilitation Group is an intensive, comprehensive, persistent pain, or what I like to also call overprotective pain group. The group has been running since 2016. In 2016, we found a gap in our veterans' care when it came to non-pharmacological treatment, when it came to treating overprotective or persistent or chronic pain. The group was formalized based off of a need. Veterans need whole health, comprehensive care. So this 8-week, 3 times a week group, which makes it comprehensive and intensive, formed from there. And with our comprehensiveness from our core disciplines of our physical medicine rehabilitation doctors, our mental health pain psychologists, our physical therapists, our pain pharmacists, then also our whole health coach. Those 5 core disciplines make up the FRG or Functional Rehabilitation Group. And since then, we've noticed that we've been able to really challenge patients to live a healthier life, healthy behaviors, healthier lifestyles, and even carry that beyond the 8-week-long group. Treating chronic pain or persistent pain is a lifetime or full-time job. So that's what we want our patients to understand, that there's life beyond persistent pain.
So I'm involved in the Functional Rehabilitation Group by conducting screening assessments for patients who are interested in participating in the program. So I meet ideally with everybody who's getting ready to start to talk with them about their goals related to FRG, problem solve any potential challenges, and make sure that they have mental health support that may be necessary in order to help them be successful with the program. I also help facilitate referrals for the group, since a number of my patients are good candidates for the program, and I coordinate care with the providers who are also part of the interdisciplinary team that runs FRG. So we know that chronic pain benefits most from an interdisciplinary approach to pain management that incorporates many aspects of overall health, including mental health, physical therapy, occupational therapy, nutrition, pharmacotherapy, our medical colleagues. Chronic pain really benefits from a multidisciplinary intervention, and FRG is rooted in that, which is part of what makes it so valuable for patients.
It taught me that I can do things even through the pain that I have. And there was a lot of interesting topics that I actually got personally involved in after the FRG classes were done. The biggest one was biofeedback, and then the pain psychology part, that really helped a lot. And then I kind of took it on my own and started going to the gym, and after that, it's like everything seems to be working much better.
I learned overall I do not have to allow my chronic back pain to keep me stuck at home and not being able to move around and enjoy my life. I learned that I get up and I move around, I do chair exercises, and I've learned overall that I don't have to allow my chronic pain to keep me sitting down and stuck. I get up and I move and I try to go on with my life. And you just learn that you don't have to allow your pain to take over your life, that you can still have a life with chronic back pain. That's what I've learned overall.